need to be stored in the fridge,
Yes.
and it should not be kept in the room temperature for more than 24 hours.
Okay.
Okay, and also each bottle of insulin shouldn't last for more than 30 days,
Okay.
because if it's more than 30 days, too many penetrations and contamination, you have to throw it away.
Okay.
Yeah, but this bottle, it shouldn't last for that long anyways.
Okay.
And also there's some insulin is a protein, there's some sediment, so
Okay.
gently mix,
Okay.
okay, till the sediment is all mixed, dissolved.
Yeah, I know.
Yeah.
I know.
Yeah, so
Okay. Oh,
so
it's
it's
dissolved
simple.
now.
Yeah,
Okay,
it's very
perfect.
simple. Okay, so do not violently
Shake it,
shaking,
yeah.
because it is a protein.
Okay.
If it makes too many bubbles, then the concentration is not accurate.
Okay.
Okay, yeah, so that's basically,
Okay.
yeah,
How many times should you?
till the sediment is all gone.
Oh,
Like if
okay.
you
At the
see
Yeah,
it's
bottom,
like
you
a
can
milky
see that
color.
the bottom, the sediment is,
it condenses at the
yeah,
bottom, and you want to
that's,
get rid of that.
yeah, it doesn't have much anymore. Okay, so that is that is already mixed.
Okay.
Okay,
Perfect.
That's the insulin, the syringe.
Okay, hold on to this minute, Rachel.
What?
It's only used one time.
Okay.
Okay.
Yeah. Like normal needles.
That's right.
Yeah.
So once it's finished, you store it in a Ziploc bag or container, and once you come in, bring the used needle, we'll send it for incineration.
Okay.
Okay.
James. Hey, it's because he saw
Yeah.
there's a new room
so
to go to.
This is a half a cc, and which is 20 units,
Okay.
because the insulin is 40 units per cc.
Okay.
40 units per cc. This bottle is 2.5 cc's, and it's 100 units.
Okay.
So your cat that needs 3 units, that's the empirical dosage. 3 units twice a day, which is 6 units a day. 6 units a day, so 1 month, 30 days, it needs 180 units, like 2
So
bottles.
2 bottles.
Yeah,
Okay.
so each bottle lasts for 2 weeks, so that's good.
Okay.
Okay, and you will probably lose a little bit anyways.
Okay.
So this cap, remove it and turn upside down to siphon the insulin. You get the more than 3 units, and you tap it, just get air to the top and push it back into the bottle. Get to the exactly 3 units mark.
Oh,
Okay.
okay. So less than 5.
That's right.
Yeah. 3.
So you get a little bit more, then you tap it, let the air goes to the top, and now it's 3.
Okay.
3.
Yeah, making sense?
So 3 lines, pretty
That's
much.
Three
right.
lines.
Okay.
3 lines.
That's
Okay.
right. So now, how do you give? What I always do is you can give it anywhere underneath the skin.
Underneath
And
the skin.
yeah, I use 3 fingers to grab the skin,
Okay.
and you go underneath the thumb in a 45-degree angle. Okay? And in that way, it won't penetrate to the other side of the skin.
Yeah.
Then you can draw, making sure no blood, and then you can push. Okay?
Okay.
The key is not to use 2 fingers,
Okay.
and then you go that way, and the insulin goes on the fur. Okay?
Okay.
It has to be inside.
Okay.
So it's not that critical whether it's in the subcutaneous tissue or in the muscle.
Okay.
And if there's blood, it's not that critical either. So so basically it needs to be inside.
Okay.
If the cat is not getting insulin,
Yeah.
you forgot, or if you lose a little bit and not enough, that's never a major problem.
Okay.
The major problem is you give too much
Too much. Yeah.
or double dose. One person give it and you didn't tell other family members, and
Yeah.
the
We're
second
gonna
person.
create a board.
That's right.
Yeah.
Making sure that and only if the cat is healthy and
Yeah.
eating, you give the insulin.
Okay.
If the cat is sick, it's puking and not eating, don't give insulin.
Okay.
If it's no insulin, it's not the critical, not the life-threatening. If you give too much, it could be, because the insulin is lowering the sugar.
Okay.
If the sugar is already low without any food in the stomach,
Yeah.
then the insulin will make the sugar to 0 in the blood.
Okay.
Then the brain only needs insulin and needs glucose as a
Okay.
food. So the brain has no food.
Okay.
The brain will go on strike,
Yeah.
will have seizures.
Yeah.
Okay, so you
Do you think he
understand.
was having seizures?
Pardon?
Do you think he was having seizures?
If you didn't give insulin,
Yeah.
you probably didn't have any seizures.
Okay.
The seizure is because of low sugar.
Oh,
Too low.
okay.
Yours is too high.
Too high.
Yeah, so it's not that problem.
Okay.
Okay, so so
I
that
think she's
is
very mad right now.
yeah. So that is how we do the insulin
Okay.
injection. I'm also going to do a demonstration
Okay.
for taking blood and do the glucose
Yes,
test.
please,
Okay,
yeah.
so in that way, you will be able to do it at home. Do the measurement at home. It's more accurate than you
Okay.
bring the pet here for me to do it.
Okay.
Because when the pet is nervous and they can be upset and the glucose may not be accurate.
Do you think he's upset right now?
I just do a demonstration, show you how to do the test.
Cause I'm like, he looks
Yeah.
really angry.
Yeah,
Does it hurt them to get insulin?
it's a teeny tiny needle,
Yeah.
so that is not really hurting,
Okay.
and they don't usually complain.
They get used to it?
Oh, you guys shaved him.
Yeah, we took a blood.
Oh,
Yeah.
I see. I see.
They test when you have a machine.
Mhm.
If you don't have a machine, usually you buy 100 tests.
Okay.
The pharmacy give you a machine for free.
Yeah.
Okay, so that's how you prepare.
Okay.
And I use a needle to make a little poke from the tips of the ear. And it's a little tiny blood vessel there. And if it's bleed too much, it's not big deal. You'll stop right away, and
Okay.
And I also grab a piece of tissue. Yeah, you massage a bit to get a little bit more blood out.
Okay.
Okay, so that's the amount of blood you will need. Okay, then you push this test strip in to trigger the machine to turn on.
Activate?
Yeah,
Okay.
activate. And then once you have that, you
Okay.
can put the blood in. Okay, so don't push it in before you have blood.
Okay.
Okay, then you have a piece of tissue to hold it. 19.1. The normal is between 3 to 6.
3 to 6.
Yeah.
Oh, his
Yeah.
sugar's so
So that is
high.
high. Yeah, that's right. That's due to diabetes.
Okay.
So the measurement should be done 4 to 6 hours after the insulin injection.
Okay.
We wanted to know the lowest.
Okay.
We wanted to have the lowest as even higher than normal.
Okay.
The lowest 4 to 6 hours after insulin should be around 8 to 10.
Okay.
Okay, because if it's normal, then it could be too good to be true.
Okay.
Maybe it's going down more, maybe it's bounced to 0 then bounce back.
Okay.
So just do a random test.
Okay.
In the future, we can always, if you have difficulty managing it, we can do a glucose curve in the
Okay.
clinic. It's
Okay.
every 2 hours to take the glucose before insulin, and 2 hours every 2 hours after insulin.
Okay.
Yeah, but that's we'll talk about
Should
it.
you be testing his blood every day?
No,
No?
maybe once a week.
Once a week?
Yeah, you
Okay.
don't need to create too much work.
Okay.
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 So this is how we do the test and how we do the insulin,
Okay.
and the feeding is small meals more
I
frequently.
have a question.
Yes.
Do you use the same one to do the test? for
No,
the-
no, no,
The-
no.
No, just
When you are ready to do, I will donate some needles to you.
Oh,
All
You
right.
only do one time.
one a week.
Yeah.
One a week, right?
Yeah.
Okay.
thank you.
That's about one every 7 days, right?
It doesn't have to be exactly, just to get a random test to
Okay.
making sure the dosage is
So-
it's reasonable.
Yeah, got it. No
Next
problem.
Saturday.
Is he
Yeah.
acting like this just because he's going through